Good evening, everyone. So, in this video, I will discuss with you some anti-helminthic and helminthic drugs. And this topic I will discuss in two parts. First of all, I will discuss with first part. Now, for the roundworm, hookworm, or the pinworm, the treatment of choice is the albendazole, mebendazole, parental palmoic, piperazine, and levamisole. For the threadworm, the treatment of choice is ivermectin or albendazole. For the whipworm, the drug of choice is albendazole or mebendazole. For the filariasis, the drug of choice is diethyl carbamazine, ivermectin or albendazole. For tapeworms, the drug is praziquantel, niclosamide or albendazole. For heart disease, the drug is albendazole or mebendazole. So first of all, I will discuss with you benzimetazoles, which is also known as the albendazole. It is a broad spectrum antihelminthic drugs. It is the drug of choice or the primary therapeutic application for treatment of the hydrated disease and cysticercosis. Now, it is the treatment of choice for the hydrated disease and the cysticercosis, and it is also used for the treatment of intestinal nematodes like Ascariasis, Trichuriasis, Strongyloidiasis, and pinworm and hookworm. So, mechanism of action is it is the microtubule synthesis inhibitor. So, it inhibits the microtubule synthesis in the nematodes, that is the intestinal roundworms, and that will lead to no formation of the DNA, or that will lead to killing of there is no uh, multiplication of the nematodes doesn't occur, and thus it will lead to cell death. And it can also impair the glucose uptake. Intestinal parasites are immobilized and die slowly. So intestinal parasites, that is the intestinal roundworms, they will get immobilized and they will die slowly because it also impairs the glucose uptake. So that will lead to no generation of an ATP in the body inside the parasites. It is larvicidal in hydrated disease, cysticercosis, ascariasis, and hookworm infection. Also ovicidal in ascariasis and chylostomiosis, hookworm, and trichuriasis. So next is pharmacokinetics. It is benzimidazole carbamate. It is administered orally and absorbed erratically, means unpredictable. Absorption can be increased with fatty meal. So we have to give it with fatty meal because absorption can be increased with the fatty meal of the albendazole, and it has to be given orally. And it is metabolized in liver, and it forms the active metabolite, that is the albendazole sulfoxide. So its half-life is 8 to 12 hours. Sulfoxide is mostly protein bound and it distributes well to tissues and enters bile, CSF, and hydrated cyst. Means it distributes well to the tissues and it enters the bile, CSF, and hydrated cyst. Metabolites are excreted in the urine. Clinical uses used on empty stomach when used against intraluminal parasites, but with fatty meals when against tissue parasites. Because when it is to kill the intraluminal parasites, then we give it empty stomach. But to kill the tissue parasites, we have to give it with the fatty meal. So it can be given in ascariasis, trichuriasis, hookworm, pinworm infection. Children up to under 2 years, 400 milligram OD as a single dose repeated for 2 to 3 days, and heavy ascariasis repeated after 2 to 3 weeks for pinworm. So it is repeated after 2 to 3 weeks for the pinworm. Hydrated disease, drug of choice. It is the drug of choice for the hydrated disease, and the dose is 400 milligram twice with meals for 1 month or longer. Neurocysticercosis, it is controversial as it has not proved superior to corticosteroid alone. It is controversial because in neurocysticercosis, it has to be given along with the corticosteroid to decrease the inflammation caused by the dying organism. And it also reduces the duration of the course, that is 400 milligram twice daily for 21 days. Albendazole is given in the treatment of the neurocysticercosis. Other infections, drug of choice in cutaneous and visceral larva migrants, intestinal capillariasis, and others. Adverse reaction is it has In short-term use, no significant adverse effects occur. In long-term use, as in the treatment of hydrated cyst and cysticercosis, abdominal distress, headache, fever, fatigue, alopecia, increased liver enzymes, pancytopenia can occur. Blood counts and LFT should be followed, not given during pregnancy and in hypersensitive people. This is a contraindication in pregnancy and in hypersensitive people. Next drug is mebendazole. It is also the benzimidazole and it has the wider spectrum of activity and is more safer than albendazole. Mechanism of action is it inhibits the microtubule synthesis in nematodes. It is microtubule synthesis inhibitor and it also irreversibly impairs the glucose uptake. Means ATP generation is also not there. So it will kill the parasites, intestinal parasites. They become immobilized and they will die slowly. It kills hookworm, pinworm, ascariasis, and trichotis eggs. It will kill the hookworm, pinworm, ascariasis, and trichotis eggs. Pharmacokinetics is less than 10% of the orally administered drug is absorbed. Absorption is increased with fatty meal, and it is 90% protein bound. And it is converted to inactive metabolites rapidly in the liver, and the half-life is 2 to 6 hours, and it is excreted in the urine. Clinical uses is it is taken orally before or after meal. Tablets should be chewed before swallowing. So, clinical uses is it is taken orally before or after meal, and tablets should be chewed before swallowing. Pinworm infection, the dose is 100 milligram as a single dose or to be repeated after 2 to 3 weeks. Ascariasis lumbricoids, Trichotis tricora, hookworm, Trichostrongylatitis, 100 milligram per day, twice daily for 3 weeks, 3 days to repeat it in 2 to 3 weeks. In adults and children over 2 years, cure rate is 90 to 100% except hookworm, but there occurs marked reduction. In adults and children over 2 years, the cure rate is 90 to 100% except the infection caused by hookworm, but there occurs marked reduction. Intestinal capillaries, 400 milligram per day in divided doses for 21 days or more. Trichinosis, it has limited efficacy against adult worm, 200 to 300 milligram for 3 days, then 400 to 500 milligram for 10 days with fatty meals, and co-administration with corticosteroids in severe infection. Now, adverse drug reaction is mild GI disturbance can occur, no side effects in short-term therapy. With high dose, hypersensitivity reaction can occur, agranulocytosis can occur, alopecia, elevation of the liver enzymes can occur. Use with caution under 2 years of age may cause convulsions. Enzyme inducers and inhibitors affect the plasma level of the drug, and hepatic parenchymal disease can be caused. Thiabendazole, it is also the benzimidazole. It is chelating agent and forms stable complexes with metals, including iron, but doesn't bind with calcium. And it is rapidly absorbed. Half-life is 1.2 hours. It is metabolized in liver. 90% is excreted in urine. It can also get absorbed through skin. Mechanism is the same. That is, this is uh, microtubule is synthesis inhibitor, and it is also ATP generation doesn't take place because it inhibits the glucose uptake. So it is ovicidal for some parasites. Clinical uses should be given after meals and tablets should be chewed. For strongyloids caused by the threadworm, 25 milligram per kg, not more than 1.5 grams, twice daily for 2 days, can be repeated after 2 weeks. In hyperinfection syndrome, drug is continued twice daily for 5 to 7 days. For cutaneous larva migrants, thiabendazole cream is applied topically or drug can be given orally for 2 days. Now, adverse reactions are, it is more toxic than other benzimidazoles. It causes GI disturbances, pruritus, headache, drowsiness, psychoneurotic symptoms, irreversible liver failure can occur, fetal Stevens-Johnson syndrome, not used in children below 15 kg weight, pregnancy, hepatic, and renal diseases. It is not used in children below 15 kg weight, pregnancy, hepatic, and renal diseases. Now, parental palmoid, it is a broad spectrum antihelminthic. It is effective in trichosis infection caused by whipworms and Trichostrongylus orientalis infections. And oxalic palmoid is effective. Pharmacokinetics, it is poorly absorbed orally, and half of the drug is excreted unchanged in the feces. Mechanism of action is it is the how it acts is it is the depolarizing neuromuscular blocking agent that causes release of the acetylcholine and inhibition of cholinesterase leads to paralysis of the worms. Means it is the neuromuscular blocking agents and it will cause the release of the acetylcholine and it will inhibit the cholinesterase enzyme. So there will be increased levels of acetylcholine in the muscles in the muscles of the parasite, which will lead to paralysis of the worms. Increased muscle contractions. Thiabendazole efficacy and clinical uses. It is very effective against luminal organisms. It is not effective against migratory stages in the tissues or against the ova. So it is not effective in the migratory stages in the tissues or in the ova, and it affects the luminal organisms. Entobius vermicularis pinworm 11 milligram per kg as a single dose to be repeated 2 weeks. Ascaris lumbricoides common roundworm, single dose to be repeated after 2 weeks. And Chylostoma duodenale hookworm, single dose for light infection, but a 3 day course is necessary for heavy infection, especially Necator americanus. Adverse reactions is it can cause mild GI disturbances, drowsiness, headache, insomnia, rash, fever. Contraindication is in the liver disease, pregnancy, and children under 2 years of age. Piperazine is the drug which is used for the ascariasis and is readily absorbed orally and excreted in the urine. Mechanism of action is it causes hyperpolarization of the ascaris muscle by GABA agonistic action. Means it is the GABA agonist and it will cause the hyperpolarization of the ascaris muscle, opening of the chloride channels causing the relaxation and depresses the responsiveness to contractile action to the acetylcholine. Means there will be paralysis of the ascaris because of the hyperpolarization and blocking of the acetylcholine at neuromuscular junction, expelling the live worm by the normal peristalsis. Means it will open the GABA mimetic channels and it will cause hyperpolarization and it will also block the action of the acetylcholine. So it will lead to paralysis of the muscles of the ascaris of the round ascaris and it will lead to expelling the live worm by normal peristalsis. Not recommended for other helminth infections. Pharmacokinetics is it is readily absorbed orally and excreted unchanged in the urine. 75 milligram per kg per day for 2 days once daily is the dose. And treatment is continued for 3 to 4 days or repeated after 1 week in case of heavy infections. Adverse drug reactions are GI disturbances, neurotoxicity, allergic reactions, serum sickness. Contraindications are epilepsy, impaired liver or kidney functions, pregnancy, and malnutrition. So this is the flow chart of the drugs used for the treatment of the human intestinal nematodes. The drugs for the scariasis are the piperazine, parental palmoid, albendazole, mebendazole. For the hookworm, the drugs are piperazine, parental palmoid, albendazole, and mebendazole. For the entropius, the drugs are piperazine, parental palmoid, albendazole, and mebendazole. For the trichoris, the drugs are albendazole and mebendazole. For the strongylites, the drugs are albendazole, mebendazole, thiamendazole, and ivermectin. So that was all for the treatment of the human intestinal nematodes. I hope you understood this video, and if you understood this video and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. And the next part of the drugs will be covered by me in the next video. Thank you. Be happy, be blessed, stay safe, happy learning. All the very best. Thank you.